Hello, I'm Dr. Brandt Gibson, and tonight I would like to talk to you about tendonitis as a common problem that we actually see on a regular basis. So, number one, what is tendonitis? Tendonitis is basically an inflammation of the tendons, uh, either from strain or sprain or overuse, and it gets an inflammation. It can be pretty painful and pretty problematic that way. So, that's tendonitis. Why does it happen? Truthfully, a tendonitis could be anything that's actually overworking a tendon. It could be an overuse injury. We're saying, okay, I'm doing activities over and over and over again and creating that problem. It could be an injury to the tendon itself. It could be a strain where you stepped off a curb funny or something and twisted it just right and strained that tendon. There are multiple different reasons why it could happen. Number three, what can you do for it at home? If you have a tendonitis, you're having pretty good pain in a tendon, the best way to treat it is really the same way you treat any other type of injury. The acronym is RICE: rest, ice, compression, elevation. So rest would be basically you want to limit what you're doing, find ways to take the pressure off that tendon, whether it's different shoes you're wearing or different activities that you're doing. It's trying to alleviate that. Number two is ice. Icing that area for a period of time will decrease the swelling. Compression actually works really, really well. Even just wrapping it with a simple ACE wrap or wearing a brace or something like that will take the pressure off that tendon. And elevation, anytime that you're down, if you lift it up, it'll decrease the swelling in that area. Number four, when you go see the doctor, if the pain is getting worse or it's not getting better with some of these at-home treatments, it's worth being evaluated for the tendonitis to see if it's a tendon tear or something more serious that needs to be treated even more aggressively. That also allows being seen by a doctor can allow you to get in some certain types of treatments, say a boot or something similar that would allow you to be treated in a different way. So this is Dr. Brandt Gibson. This is your Podiatry Tips Day 206, tendonitis and what you should do for it. Have a great night.